There is a disease in this country that affects the lives of more infants than any other disease. This disease is also the leading cause of death in infants more than any other condition. This disease is congenital heart disease. Based on my research of such organizations as the American Heart Association, the Children's Heart Foundation, CHD.com, and the March of Dimes, along with my own personal experiences, I will present information about this disease that affects the lives of more infants than any other disease. In a society that places much of its focus on mainstream diseases or defects such as cancer, Down syndrome, and HIV/AIDS, congenital heart disease affects the lives of approximately 35,000 infants each year. During the minutes that follow, I will tell you how congenital heart defects affect over 1 million lives each year in America, the specifics of hypoplastic left heart syndrome, and how hypoplastic left heart syndrome personally affected my own family. According to congenitalheartdefects.com and the March of Dimes, congenital heart defects are the #1 birth defect found in infants. According to the March of Dimes, each year there are approximately 35,000 infants born with some form of congenital heart defect. This means that right now, according to the American Heart Association, there are approximately 650,000 to 1.3 million people alive in the United States today that are affected. According to CHD.com, this equates each year to 1 out of every 115 to 150 births. This is put further into perspective when one realizes that something more commonly known, such as Down syndrome, affects approximately 1 out of every 800 to 1,000 births. Congenital heart defects are also the leading cause of birth-related deaths. Most are not life-threatening, but those that are require immediate attention and oftentimes surgery. This is the case with hypoplastic left heart syndrome, one of the rarest and most intensive of all congenital heart defects. According to Cincinnati Children's Hospital Medical Center's website, hypoplastic left heart syndrome, or commonly known as HLHS, is one of the most complex cardiac defects and remains probably the most challenging to manage of all congenital heart defects. In HLHS, most of the structures of the left side of the heart are drastically underdeveloped. This means that the left atrium and the major blood vessels around the heart are underdeveloped and unable to function at a life-sustaining rate. This is even further evident with the closing of the PDA, the patent ductus arteriosus. The PDA is a blood vessel found normally in the fetus, but closes within the first few days after birth. It assists in supplying blood to the fetus, but closes once the baby's own lungs and heart take over fully after birth. Medication must be given swiftly to prohibit the closing of the PDA postpartum. In order for an infant to survive HLHS, 3 surgical procedures are required. The first procedure is the Norwood. In this, the right ventricle, the right side of the heart, is made to be the main pumping chamber. Also, the aortic arch, the main blood vessel, leaving the heart, is reconstructed using a piece of the pulmonary artery. Finally, a shunt is put in place to carry blood to the lungs. The second procedure is referred to as the Glenn and is done at 3 to 6 months. The third procedure is the Fontaine, which is done on average somewhere between 2 to 3 years. These surgeries are to redirect blood flow returning to the body to the lungs at first instead of the heart. In May 2010, my own family became firstly acquainted with HLHS and the lasting effects of a congenital heart disease. My third child, Benjamin, who is seen here, was born with HLHS. He was not diagnosed until approximately 14 hours after his birth. Because of this delay in diagnosis, his PDA began to close before receiving the necessary medications. By the next morning, his heart went into shock and the doctors feared he would not survive through the day. He was able to defy the odds medically early on, but he did pass away in August of 2010. He had lived 102 days. While he suffered with some additional medical conditions, the cause of death was determined to be heart failure. As you can see, congenital heart disease is a serious medical condition. Our society goes to such great lengths in educating about what are seen as mainstream diseases without giving much focus to congenital heart defects. Congenital heart defects are the most common birth defect in infants, with hypoplastic left heart syndrome being one of the most rare and complex. Because of the staggering statistics, we as a society must become more aware and focused on this quite common, yet often unthought of disease.